We have folks are joining both on Zoom and Facebook Live, so we will begin shortly. My name is Charles Parasino, and I'm the Communications Director for Congressman Larson. Um, if you have a question for the Congressman, you can put it in the Zoom Q&A section with your name and town, or if you are on Facebook Live in the comment section, again with your name and town, and we will try to get to as many questions as we can tonight. So without further ado, I will turn it over to Congressman Larson.
Well, thank you, Charles, and welcome everybody. We like to make sure we're reaching out as often as we can, and are given everything that's going on in Washington, D.C. with the shutdown. We wanted to make sure we were informing the public of what's happening. We'll continue to do. We did an event today in Manchester. We're doing one tomorrow at noon in West Hartford, with the idea in mind that as it relates to the closing, there are a lot of questions that individuals have, and we want to make sure that first and foremost, you know what government agencies are open, starting first and foremost with ours and our phone number and how to get in touch with us. And we encourage everybody to do that, especially if you have a problem with anything revolving around a governmental concern during this shutdown period. We're also fortunate this evening to have with us James Michel from Access Health Connecticut. And I think he can help and also illustrate just how real this is and what the impact is going to be on uh, the average citizen, and why we are fighting hard to reverse this trend. And as you're probably all full aware, we were in Washington earlier this week, and unfortunately, we're not joined by our colleagues who were told to stay away and not join in further negotiations with the Democrats. And as the president indicated, that he was okay with a governmental shutdown. Well, not only are we not okay with the governmental shutdown, we are also not okay with people losing their health insurance coverage, and that health insurance coverage rising dramatically for many others to the point where they may not be able to uh, afford it, or have to make decisions where there's a choice between eating and uh, heating and cooling your home and paying for health care. And we've seen too often in the past when happens when that occurs. And that, of course, will create a unbelievable problem for our hospitals and healthcare facilities, et cetera, which is why we held a conference on Monday as well, and had a mother of four speak, a father who has cancer, and probably highlighted by a nurse who went over just how many families are impacted and how the workforce at our hospitals and healthcare facilities will be impacted, and then what happens in general. So thank you for joining us this evening as we have this seminar in an effort to reach out to the citizens of the First Congressional District and beyond, but to further update you on what's taking place here. Under the Republican budget Trump signed into law, 15 million Americans will lose health care, including 167,000 citizens in the state of Connecticut. And frankly, that's unacceptable. And it's put in place primarily, and this is the most galling thing for me, so that billionaires can get a tax cut. That doesn't make any sense at all. I think even billionaires are probably embarrassed by the fact that there would be people would be thrown off of their healthcare system or see their healthcare dramatically rise so that they could get a tax cut. The billionaires weren't asking for this tax cut. And you've heard the story over and over again. There's no way that that money ever trickles back down to the general public. That's why we're fighting tooth and nail, and we expect our colleagues to negotiate with us. We know that they're hearing the same thing we are back home. They're hearing it from their hospitals, they're hearing it from their nurses, they're hearing it from their healthcare providers. They're hearing it from citizens, and they're saying, "Oh, well, don't worry, there's still time to negotiate." Well, a lot of those notices went out today. And having said that, and I'm going to turn to him for some comments, I'm going to have James Michel from Access Health Connecticut talk about this impact in real terms, and so that the public has a better understanding of that. And then we'll throw it open to questions that you might have regarding what's open during the shutdown. James?
Good afternoon, all. I'm James Michel, the Chief Executive Officer for Access Health Connecticut. I want to express my thanks and appreciation to Representative John Larson for his leadership in this in these challenging times, and also thank him for the invitation to participate in this community town hall to discuss the impact of the expiring enhanced premium tax credits, which made health insurance affordable to more Connecticut residents who purchase health insurance through Access of Connecticut, the health insurance marketplace for the state of Connecticut. There are many federal changes impacting Connecticut residents in their health coverage. I'm here this afternoon to share the 2026 impact from the likely expiration of the enhanced premium tax credits on Connecticut residents who purchase health insurance through the marketplace. Enhanced premium tax credits will expire on December 31st, 2025, unless extended by Congress and the President. The enhanced premium tax credits were first introduced by the American Rescue Plan Act and extended through the Inflation Reduction Act in 2021. It's possible that the federal government will work to extend them before they expire. However, there's no current indication that they will continue into the 2026 health insurance plan year. We have prepared some detailed information to help you understand the impacts to specific populations in Connecticut. Please note that all of the data I'm sharing with you this afternoon is calculated using 2026 premium rates. We currently have close to 160,000 Connecticut residents in the Connecticut health insurance marketplace. If the enhanced premium tax credits were not extended, more than 142,000 customers currently enrolled will receive less financial help, and some will no longer receive any financial help at all. Approximately 28,000 Connecticut residents who have income over 400% of the federal poverty level will lose all their financial help. That's nearly 20% of the population who are currently receiving financial help through the exchange. Let me put that into some context. If the enhanced subsidies are not extended past plan year 2025, the average Connecticut residents receiving financial help through the exchange will pay an average over $4,000 a year. That's an average for the health insurance. And some families earning income just over 400% of the federal poverty level will experience significant cost increase. I have two real examples I would like to share with you. A married couple in their mid-50s living in East Hartford has an annual income of $95,000 a year. Currently, for 2025, they're paying $673 a month for their health insurance. If the enhanced subsidies are not extended and they're staying in the same health plan next year, they will pay $2,608 a month, almost $23,000 a year of their income will go towards health insurance for next year. Just think about the impact that would have on them. Here's another example. A married couple in their mid-60s living in Hebron has an annual income of $107,000 a year. They currently pay $758 for their insurance monthly premium. If the enhanced subsidies are not extended and they stay in the same health plan next year, they will pay $4,013 a month. That is almost $40,000 of their income would have to be dedicated to health insurance for the entire year. Just process the impact that would have on the family, and all because Congress and the president have not acted to extend these critical financial help for our residents in Connecticut. Finally, I have been hearing in the news certain elected officials stating that undocumented residents are receiving premium tax credit in the marketplace. I would like to make it clear to everyone that the Affordable Care Act has never allowed any undocumented individuals to receive any premium tax credit on the health insurance marketplace. The system we use to verify Connecticut residents who apply for health insurance we verify every applicant with the federal government. And if they are not properly documented, they are simply rejected. So whatever you're hearing, it is a lie, it's not true. This is since day one. The other item I want to close with one more statement. We are hopeful that Congress and the president will act to extend these enhanced subsidies before the end of this month to avoid any major disruption and confusion for the 20 million plus Americans who purchase health insurance through the exchange, especially in Connecticut. The reason that they need to act immediately is because open enrollment start in less than a month, on November 1st. Should they extend these enhanced subsidies after that date, the adjustments to rates, IT systems, premium billings, approvals that the insurance department would have to reapprove, and all the changes that would have to take place takes time. This would be very disruptive to the entire marketplace, especially to the folks who buy health insurance through the exchange. Most of them right now is just going to wait and see what happens, so they will go without any health insurance. But if you buy insurance on November 1st, you have to pay your premium by December 15th for your insurance to kick in by January 1st. So if they approve the enhanced subsidies after December, the changes, the adjustments, especially if you have already paid your first month premium, the adjustments that the insurance companies they have to make, it will be complete disruption across the board for everyone. So, Congressman, I want to end there, stop there, and let you and anyone to ask any questions. Hopefully, I've given you enough of a picture of how disruptive, how costly this will be to Connecticut residents.
Well, thank you, James, and we greatly appreciate you taking time this evening so that someone from the healthcare sector was here to lay it out for people, the drama that we're working with. I also want to commend my colleague, Rosa DeLauro, who is the point person for both the House and Senate. She is leading the way. As many know, she will be the chair of the Appropriations Committee when we return to the majority in 2026, and currently the ranking Democrat. But I also, at the outset, gave you I said to make sure you call our office, but we want to make sure that everyone has our number, which is 860-278-8888. And please call our office. We get a number of questions, and most notably, I'll just review a few of them. Will I continue to receive my Social Security benefits? And the answer is yes. Beneficiaries will continue to receive Social Security and SSI benefit payments. Most services at Social Security Administration, the SSA, will continue, including processing applications for new benefits and issuing Social Security cards. Some services, including benefit verifications, have been halted. Social Security, as you're probably already aware, has been cut by more than 7,000 people phone services that were already in bad need of help and modernization have not taken place, and regional offices have been closed. This is an attempt going on right before our eyes. Many of you have heard me talk about this and will continue to hear me talk about this. This is privatization going on right before our very eyes, and we will continue to fight and resist that. Medicare, Medicaid, and the Affordable Care Act coverage be disrupted? Will it during this time? Medicare and the Affordable Care Act coverage is not impacted by the shutdown. The Husky benefits will continue as normal unless the shutdown continues through January of 2026. We all obviously hope that that will not be the case, and we'll be working to make that not the case. Will my mail still be delivered? Yes, the U.S. Postal Service is not affected by the shutdown. Will passports and visas still be issued? Yes, consular services, passport services, visa services are continuing during the government shutdown. Passport acceptance offices located in buildings operated by an agency that is shut down are not open, but most sites are unaffected. If the shutdown is prolonged, passport and visa insurance could be delayed. Again, on any or all of these instances, please contact our office. How will the federal workforce be impacted during a government shutdown? Many federal workers are furloughed. All federal workers, regardless of furlough status, will go without pay for the duration of the shutdown, including an estimated 10,464 workers in the state of Connecticut. I spoke with many of them out at the airport just this past weekend, and again assured them that we would be working to keep government open and explain why and what we were fighting for. And I think by the time we were through explaining how people were being held hostage and how many people would be kicked off of their health care and find themselves in this god-awful solution so that there could be tax cuts for billionaires, certainly just as unacceptable. A lot of people have called and asked about the impact on food assistance, better known as SNAP, the Supplemental Nutritional Assistance Program, will not be affected unless the shutdown lasts longer than a month. Now, the longest the shutdown has lasted in the past has been about 36 days. We do not want that to be the case. We will work hard to get this done as quickly as possible, but we can't work unless our colleagues join us at the table. And this week, they didn't even bother to come into Washington itself. We're hopeful that they will come in next week. We haven't heard official word yet, but we're prepared to roll up our sleeves and get the work done that needs to. Another question is asked is how will travel be impacted? Well, air traffic controllers and Transportation Security Administration, better known as TSA, will continue working to make sure flights operate safely. Travelers should, however, monitor airports for potential delays, which if you travel as much as I do, note that that has been an issue already, and this issue will be compounded as well. But we all should give a note of thanks to these workers who are coming in and doing their job under duress. So for the most part, essential services will continue. If something has happened where you feel you've been disrupted and haven't gotten a service, please call our offices so that we can intervene on your behalf. What's most disconcerting to me is that the president would allow this to go forward and knowing the people that were impacted. What hurts the most is that this is a president who's never had to worry where his next meal was coming from, never had to worry about heating and cooling his home, never had to worry about paying rent or a mortgage or any kind of utility bill. And so there's a tendency to be crass and careless and uncaring. Our job is to represent the people of the United States. And these are all benefits that you have paid for and earned. And it's our job and responsibility to make sure that you receive those. Uh, so to sum it all up, you will continue for now to receive Medicare, Social Security, veterans benefits, but all staff at these agencies have been furloughed. And many, as I pointed out, both at the Veterans Administration and the Social Security system, have been laid off before this shutdown. You will continue to receive your mail, passports will be processed, SNAP benefits will continue, and airports are operating as usual, but monitor for potential delays when you're traveling. This could all happen. With that, why don't we open it to questions, Charles? And if we could take the first question, that would be great.
Yes, thank you so much, Congressman. Our first question comes from Gina in Weathersfield for both you and James. And she asks, when do Affordable Care Act tax credits expire?
Well, the Affordable Care Act tax credits expire for plans starting on January 1st, 2026, but it's a little more complicated for that. And you heard James go through that in his opening remarks. I believe letters went out October 1st. James, could you comment on that?
Absolutely. The subsidies, let's bifurcate them. There's a subsidies that are locked into the ACA. Those are pre-enhanced subsidies. Those are guaranteed. Then there's the enhanced subsidies. And those are the extra money that was given to people to make health insurance more affordable. And that expires on December 31st, 2025. And once that's expired, then we're going to go back to what it used to be before the enhanced subsidies were appropriated or created by Congress and President Biden back in 2021. So what you're losing is the enhanced subsidies. We're going to go back to the ACA regular subsidies. Going to start in January 1, 2026, unless Congress acts to extend the enhanced subsidies. So not all premium tax credits are going to go away. Just the enhanced amounts are going to go away, which is substantial. It really made health insurance more affordable for Connecticut residents. I hope that was clear.
Sure.
Regular
Yeah.
subsidies do not expire.
Bottom line is this, you will see higher costs when open enrollment begins on November the 1st.
Across the board.
That's why we need to take action now.
Correct.
And our plan to reopen government will extend these tax credits to protect families like yours from the skyrocketing premiums that they otherwise will face if it's not here. So I want to be clear about this. When people say, well, what's the disagreement between the Democrats and Republicans? It's has to do with over what's more of a priority, people having the health care that they desperately need, or see those health care costs dramatically rise, as you've heard James talk about, so that billionaires can have a tax cut. I don't know of any American who thinks that that's fair or right, including billionaires, who I believe have got to be just as concerned about this as well. So let us take the next question, please.
Our next question comes from Robin in South Windsor, and I know you touched on this briefly before, but she asks, will Social Security and Medicare benefits continue during the shutdown?
Well, the short answer, of course, is yes, that they will. And at the Social Security Administration, however, 12% of staff has been furloughed. And on top of that, 7,000 workers were put out of business and forced to retire earlier this year. That means right now, 25% of their workforce is missing compared to last year. Now, mind you, this happens at a time when 10,000 baby boomers a day become eligible for Social Security. So, yes, we're very concerned, but we also feel, and I hope more people speak out about this. And certainly, I've been touting the clarion horn about the fact that this is yet another attempt to privatize Social Security by dismantling the Social Security Administration from within, who operates at administrative costs that are far below any private sector entity or any other governmental entity of its size. And the Social Security Administration is in charge of 300 million plus Americans. No small responsibility. And there are close to 75 million active Americans receiving payments from the Social Security Trust Fund. And the Trump administration continues to downsize them as we go forward, all while saying he's not going to touch Social Security. You're right, he may not touch it. He's trying to privatize it directly. And people ask me, well, why? Why do you think he's going after that? Why did he have Elon Musk go in there with Doge? And why are they poring over your personal records and now have taken them and placed them in an unsecure cloud? For what purpose? We, myself and Rich Neal, have issued a bill to try to make sure that they come before the Congress and answer us this question. And still, Elon Musk refused to have done that. And yet, to this date, even though we've requested that Doge come before the Ways and Means Committee and explain why they're going through people's personal data, Republicans have resisted. I think we all can guess why, because they don't want the public to understand or see what they're attempting to do in terms of privatizing Social Security. So this has to be resisted. And while you'll continue to receive your Social Security check, the administration continues to be depleted. And so there'll be even more delays and problems in getting through. Next question.
Our next question comes from Carol in Barkhamsted, and she asks, and James touched on this earlier as well, are you not supporting the Republican continuing resolution because you want free health care for illegal immigrants?
So let me
Well,
just,
yeah,
like,
go ahead, Jane. I'll kick it right over to you quick,
sure.
but I was glad that you pointed that out because this is among the many myths and rumors and lies. And I just mentioned Social Security. They say that they get Social Security checks too. They don't. No one who is not an American citizen receives a Social Security check. End of tape, end of discussion. There are people who work here who are immigrants who pay into the Social Security system as they are required, receive no benefits. But unless you're a citizen of the United States, you cannot receive Social Security payments. No one ever has, and no one ever will unless the law is changed. And there's no intention to change that law. James, let me kick it back to you
Thank you.
because I think you articulated this earlier very well.
Thank you very much. I've been with Access Health since its inception, going back to 2013, and when we're building our current technology platform, built into that system is to all the requirements of the ACA. One clear requirement is that if you are not properly documented, you are not allowed to get you're not even allowed to buy insurance on the exchange, even if you're going to pay it yourself. So no one who's undocumented are allowed to even touch our system. And if you are undocumented, you apply for health insurance. We verify every applicant's immigration status with the federal data hub. If it comes back rejected, then you are simply denied access to buy insurance and get any subsidy. So again, to the young lady in Bark Hempstead, ma'am, you are being misled, misinformed by the elected officials who are making those statements. That has never been true, and there has been any discussion about opening that up to anybody.
Here is the law. There is the truth. Undocumented immigrants cannot receive Medicare. They cannot receive federally funded Medicaid. They cannot receive the Affordable Care Act tax credits and never have been able to. That's the law. But if you don't take our word for it, it has been debunked by both Political Fact, CNN, the Associated Press, and the New York Times. What Trump and his followers in Congress don't want to talk about is what's actually at stake and what's actually happening to individuals who desperately need this health care. And again, why? So that billionaires can be provided with a tax cut? What is enough money for billionaires? I think they're even embarrassed by what's going on here. 15 million Americans are about to lose health care thanks to the Republican budget. Again, so billionaires can get a tax cut. 90% of the people who receive health care tax credits make less than $63,000 a year. This money is directed to the right place to provide the help and need that people require. That's why we're going to continue to fight to make sure that that's the case. Next question. Charles?
Our next question comes from Margaret in Windsor, and she says, I'm getting ready to retire and may be impacted by cuts to Medicare. What is being cut in the so-called Big Beautiful Bill?
Well, James, do you want to start with that and I'll add on, or do I can?
Go ahead, because there's no impact to the ACA. There are some impact, but not for retirees. All right. So the main impact with the Big Beautiful Bill is it's removing certain immigrant immigrant classes from getting any access to subsidized health. So if this young lady from Windsor is about to retire, is in that class, that certainly would impact her if she wanted to buy something in the exchange because she was denied Medicare. Then she would not she would have to pay the full price and not have any not be able to get any access. That's only if she met if she was in that specific immigration class that the bill is denying any subsidy to.
Thank you, James. And Margaret, this is a great question. And this, of course, comes after the Republican budget that President Trump signed into law set into motion the largest cuts to Medicare in our nation's history. And that comes after he swore up and down on the campaign trail that he wouldn't touch Medicare, Medicaid, or Social Security. All of which, as you might have heard his Treasury Secretary say the other day, that 3 weeks ago, that, oh yeah, the big beautiful bill, as they call it, was a backdoor way of privatizing Social Security. It's not so backdoor. They've been very public about it. And every time someone makes a statement where they tell the truth, like the Secretary did, they quickly try to correct themselves because they think they can fool and dupe the American people. His bill ends the Medicare savings program that helps seniors save on their copays and premiums. Now, it's not going to take effect immediately. And as he said to the Republicans, don't worry, it won't happen until after the midterm elections. But it triggers a 535 billion in cuts to Medicare over the next decade. Uh, and that will mean less providers will accept Medicare, and you will see higher costs for prescription drug plans and Medicare Advantage. Healthcare should be a right, a human right, not a privilege. That's what President Kennedy's vision was all about. And that's what we're fighting to reverse with these cuts so that we can, in fact, strengthen Medicare for the American people. Because at the end of the day, healthcare is a human and essential right that is needed. And it's government's responsibility to make sure that it's affordable for all Americans, not just the wealthy few. Let's take the next question.
Our next question comes from Kathleen in Bristol, and she says that she saw that Inflation Reduction Act funds were being used to keep the IRS open during the shutdown, and that they expected that to last for a week. But what will happen at the IRS if the shutdown continues past a week, past October 7th?
Well, that's a great question, Kathleen. Right now, the IRS services are continuing, but that could change next week. They haven't announced yet what their plans are after October 7th. We hope that when we get back to Congress, that they sit down and immediately correct this wrong-headed notion of shutting down the government and also taking people's health care away from them. I mean, these go hand in glove, and they know this. In previous shutdowns, they furloughed a significant number of staff. We can expect to see delays in processing tax returns and limited customer service. When we passed the Inflation Reduction Act, the funding you mentioned was all about improving customer service and cracking down on wealthy tax cheats. However, this summer they made massive cuts to Medicare, Medicaid, and the Affordable Care Act to pay for more tax breaks for billionaires. That's essentially what this fight is all about. And it's a fight worth engaging. Republicans need to come back to the table and reopen government and protect families from the healthcare crisis that they have created and shouldn't be the case. I hope the IRS services will not be impacted, but if you face any of these issues with the IRS, again, or any issues with any governmental agency, you know how frustrating it will be to be on the phone if you try this yourself and you get costs from one agency to the other or from one computer answering machine to the other computer answering machine. You're going to need to talk to human beings. Call our office. We will respond at 860-278-8888. We're here to help you. James, I don't know if you wanted to add to that. It's a little out of your lane, but
No, I think you answered that appropriately.
next question then.
Our next question comes from Jennifer in West Hartford, and she shares, I have been an outpatient mental health clinician for 20 years. I'm incredibly concerned about telehealth benefits not continuing during the shutdown and potentially being repealed once it's over. These benefits allow our patients to access mental health services that they would otherwise be unable to utilize. What can be done to prevent this?
So, Congressman,
Go ahead.
well,
Go ahead, James.
so in Connecticut, telehealth benefits are treated they're treated and paid for as if they are in-person services. Again, this is a state-regulated service. In Connecticut, as you know, has been very progressive in making sure all of its citizens have access to quality and healthcare. So I'm not so sure that that particular benefit is at risk. as long as you are in state of Connecticut, because that's determined by state requirements. I
Well,
hope
again, Jennifer, first off, I want to thank you for your question and for your extensive career and commitment to your patients. You are exactly right. Some Medicare telehealth authorizations expired on September 30th. The same day government funding expired. Reauthorizing these programs usually takes place when we pass government funding bills. The good news is this: telehealth is an area of bipartisan agreement. During the shutdown, some providers are continuing to provide these services with the expectation they will be reimbursed when it's over. Telehealth has continually been included in appropriations bills, both when Democrats were in the majority and also under Republican control. This is how government should work. We should be working together bipartisanly to serve the citizens. We take an oath of office to serve and uphold the Constitution that governs this nation we all love so much. I'm confident we will reauthorize the benefits you mentioned in any bill to reopen the government. And again, I want to applaud Rosa DeLauro for making sure that that's the case in every single negotiation that's taken place. Next question, please.
Our next question comes from Kevin in Manchester, and he asked, with the government shut down, does that mean that ICE won't be working?
Well, thank you, Kevin, for that question. Law enforcement activities are considered essential. The Department of Homeland Security has exempted ICE agents from furloughs. Workers who can assist you with your Medicare and Social Security, they've been furloughed, but ICE is essential. Many of you will recall what happened in Newington and Southington in the 1st Congressional District, with masked agents with guns coming in at car washes and taking mothers from their children. That's not the America that we know and grew up in and respect. That is the most un-American thing that can be done. We all certainly should abide by the law and respect individuals, but there is due process. And for this to happen in this country, I don't know how many people watch PBS and the specials that they've done on fascism, but when a nation is silent, when these things happen, is a dangerous precedent as well. It's why so many people are speaking out against this procedure and how it's being done. Anyone who's a criminal or is here illegally, etc., doesn't belong here. But what we've seen, and statistically as it's been reported, and the people who are being implicated in this are not the hardened criminals that he's talking about. And it's very disturbing that this continues to go on, and we must continue to speak out against it. This is Donald Trump, as you all know, wants his own secret police force, and that's precisely what ICE has become. That's why we're fighting to pass a piece of legislation entitled the No Secret Police Act, which would require agents to identify themselves. I have great respect for police officers. Hugo Beneteri, a former police officer, is on our staff and guides us with all these details and tells us about how police, the training they go through, how open they are, the conduct and accountability that goes along with being a police officer, and just how important it is. It offends them when they see people masked and armed acting as though they're true enforcement officials, when in fact, they've become Trump's personal secret police. So, the ICE raids, in my estimation, aren't about safety, they're about fear. And the way I was brought up, et cetera, and the presidents that have been the most inspiring and individuals are ones that try to bring the nation together, not divide the nation, and people who bring the country together with the idea of working together with the hope of making it a more perfect nation, not dividing it and creating fear that you could be taken or stripped of your citizenship. So these are very trying times, but the nation will get through this and will persevere through it, but it'll require, as many citizens have in Newington and Southington. The mayor of Newington, as he said to me, choked up, my wife is an immigrant. She's afraid to go out in my own hometown where I'm the mayor. That is not the America we know and love, nor should it ever be. Enforcement is important. Criminals should be punished and tracked down, but there's a way to do that lawfully and one that follows the Constitution. President looks at the Constitution as though it's a suggestion, not the rule of the land.
Hmm.
That cannot prevail. Next
Congress-
question.
Congressman, very
Go ahead,
quickly, let
James.
me add this very quickly. Every year during open enrollment, we do a lot of in-person, in-community events, and we spend a lot of time in the immigrant communities across the entire state. Part of our strategy this year is to how do we protect the immigrants who come to our event to get access to health insurance. So that's part of our thought process. Because many of them, they're just afraid to go out because of what might happen to them as you see what's going on across the country. So we have to be very defensive as we prepare to give people access to re-enroll or to buy health insurance. At every event we are doing, we are very mindful of that, and we are designing our events to make sure everyone who comes to our event are protected.
Well, thank you for that. But I think anyone listening to this is thinking the same thing. Can you ever imagine a time when you would be fearful? We are a nation of immigrants. I think everybody knows that.
Mm.
And we, by the nature of being one of the most diverse countries in the history of mankind, and clearly the most diverse democracy ever assembled in world history, means that that very diversity is our strength and will continue to be so. And we have to treat our fellow human beings as human beings. There's no question that the immigration process has to be fixed, has to be changed so that there is a clear and concise pathway to citizenship and a process to get here. Nobody condones getting here illegally and unlawfully. Uh, that's not right, but you've got to change the law. Our own Senator Chris Murphy worked bipartisanly to get such a bill before through the Senate and before the House. When President Trump said, no, pull the bill because it's better politically for us to divide and create fear than it is to solve the problem that needs to be addressed in terms of immigration reform. I want to commend Senator Murphy for his work and also Linda Sanchez of California for her work as well on making sure that we have immigration reform that allows a legal pathway to citizenship and provides for the kind of constraints that are required to make sure that our borders are protected and secure, but there is a clear and legal way for everyone, including those who seek asylum, including those who have as the individual from East Hartford who helped and assisted our troops in Afghanistan and was brought to this country because of that to protect him from his very life and then scooped up by ICE. That's not right. And everybody knows that. Next question.
We have time for one last question for your both. Thomas in Manchester, who asks, what does the Trump administration have against all Americans having health care?
It would appear to me the congressman has laid it out completely. It's all about tax breaks for the rich. And I'm stepping out in politics here, and that's not my role. But when billionaires are getting tax breaks that even most of them say we don't need it, we don't want, but they still give it to them, I think that's a clear indication. That's one of the biggest drivers of this decision across the board.
One of the longest and continuous arguments that's taken place in Congress has been healthcare. It took Ted Kennedy more than 24 years to finally get healthcare enacted under then President Obama. And with the passage of the Affordable Care Act, it then became the vow, unfortunately, of many Republicans to get rid of the Affordable Care Act rather than to work with Democrats to improve and strengthen it, to get rid of it. And during the first Trump administration, they attempted to get rid of that. And it was, even though they did damage and cuts, when the Democrats retook the House of Representatives, we restored the Affordable Care Act, again, providing and making sure that citizens would be able to afford the health care that they need. And again, when President Trump became president, he campaigned on this, as did so many Americans. He said that they were out to dismantle the Affordable Care Act. And he, as James pointed out, and when you say for what reason and why wouldn't you work with people to make sure that all of our citizens are covered and are able to pay for the insurance that they and their family members are going to require? And when the answer comes back, we needed that money to provide tax cuts for billionaires. Now they'll say, well, everybody got the tax cut. Well, that is true. A lot of people did receive tax cuts. But when you look at where the vast majority of the tax cut went, it went to the very wealthiest 1%, even under 1% in this country. And I think every American, when they look at that and get to weigh the benefit and the burden of what that means to our society and its impact on people, has to say honestly, is that the best that we could do in the wealthiest nation in the world? I don't think so. And I don't think most Americans do either. And so that's what we're dealing with in Congress currently. I hope that President Trump, and I'm sure he's hearing from not just Democrats, but unaffiliates and Republicans as well, who also have families and individuals in the 435 congressional districts who are hearing about this impact. And they're also hearing from the healthcare providers. Jeff Flax from Hartford Hospital couldn't be more articulate as the nurses and doctors there are talking about the dramatic impact that this will have on society. And let's face it, our society is an integral part of every community, evolves around healthcare and the ability to be able to see good healthcare physicians and go to clinics and receive the care that you need in order to remain healthy and vibrant contributors to this great society we all live in. We'll get there. The American people always push this forward. Senator Kennedy was right. It may take a little longer, but we're going to get there. But we don't get there unless we stand up for it, unless we say that this is what the American people want and need. And with that, I'll again want to thank James for spending his time this evening and answering questions, indicate that we will be having more of these programs, as well as being in West Hartford tomorrow afternoon at a public forum to discuss this, because I think it's important that we get out to the general public. What are the ramifications of a government shutdown? What services they have to be concerned about, and what we're fighting for, and what is the reason for this, and why it's important to get everyone back in Washington, D.C., the government reopened, and also people's health care restored.
Okay.
Thank you so much. God bless you. God bless America.
Thank you.